Hello everybody, I'm Heather Knox, Chief Executive here in NHS Lanarkshire. I'm going to talk to you today a bit about the COVID numbers like I usually do, and then I'm going to talk also about some of the system pressures that we're experiencing, continuing to experience across all of the services, across general practice, our community services, and notably also within our EDs at the moment. So starting off with the numbers, the COVID numbers yesterday were 186 new cases, 61 inpatients, which is a slight decrease in the inpatient numbers, down from, it was about 80 a couple of weeks ago and it's gone down slightly. ICU though, numbers have gone up to 9 and 6 care home outbreaks. In terms of vaccination delivery, we now have 492,000 individuals who've been vaccinated, with 880,000 doses having been administered. We're still keen to get younger people to come forward for vaccination, so if you do know people who've got a younger family who haven't been vaccinated, there are lots of opportunities across Lanarkshire for them to be vaccinated, and of course it protects them and it protects their loved ones as well if they get that done. So please encourage younger people to come forward for vaccination. We're not seeing the uptake rates as high amongst these younger age groups as we have amongst the others, where we've had a lot of success with both first and second vaccination. I said a bit about the whole system pressures. We have previously talked about the pressures that we've got around urgent care and unscheduled care across Lanarkshire, and we also had issues because we had a slightly reduced workforce. Obviously people take annual leave at this time of year, but we also had issues with up to 70 staff on any one day self-isolating. I contributed to the national guidance around self-isolation, helped drafting that, and that was issued on Friday night of last week and is now being put into action. It is voluntary, but there are a number of safeguards in place so that people can come back with the appropriate protection and testing regime to resume work as long as they are well. So that's something which we hope will help with those workforce gaps. As I say, we have been really busy in our EDs, and again, if you can help us with the messaging, please encourage people to only attend if they really need to attend, and to seek other alternatives if they can do, and also not really to bring lots of people with them. We're seeing people turning up with lots of friends and family to our EDs. We don't have space, and it does create a problem with maintaining safe distances between people. And also really just to encourage people to keep wearing their masks. It is still mandatory within the hospitals to wear a mask, so can you please reinforce these messages with people that you know and at work. A couple of slightly more positive things to mention to you. We are moving forward, as you know, with the business case for our new hospital, which will be built at Western Moffat. So a number of us are planning to go out and have a walk around the site, which we have obviously now decided. It's a lovely site, it's a wooded site, so I'm keen to actually walk around the designated area that the hospital will be built on, and I've invited other members of the corporate management team and the board to do so as well, so we can start to imagine what that site will look like. Hugely exciting. Finally, just wanted to say a bit about our strategic direction. I've talked previously on these wee videos about the strategic direction work that we're doing, and I've now started to go out with colleagues to engage staff around our initial thoughts around where we might want to take the organisation, with a particular focus on really emphasising the population and staff well-being, and also trying to tackle inequalities as well as obviously delivery of healthcare. So if there are sessions available where you work, I would encourage you to attend. You're very welcome, and look forward to working with you and getting views from staff and those people with lived experience of healthcare as part of the development of our strategic direction. Thank you for listening.